typical week in the MS nurse's life would be on a Monday. I used to start at 8:30 with the newly diagnosed clinics. I had an hour for each patient, which was good because obviously there's lots of questions. And then I would see 2 or 3 newly diagnosed patients, and that would be followed by symptom management patients. So people who were coming back for follow-up having been seen in the newly diagnosed clinics. On a Monday afternoon, I did some outreach clinics and could travel anywhere between 25 and 30 miles to outreach clinics at GPs and other centres. On a Tuesday, I would do home visits on a Tuesday morning. We were fortunate in that we could still look after our advanced MS patients, and people that couldn't get to clinic obviously needed review at home. On a Tuesday afternoon, I would see patients that were in relapse, and I'd usually see about 4 patients that have contact with a consultant neurologist through the telephone, and they would get an hour's appointment where the relapse would be assessed, a history would be taken. I would do a neurological examination of the patient if required and find out whether they were actually in relapse or whether there were other problems. Sometimes I would order an MRI scan, and then from that the patient would either receive intravenous or oral methylprednisolone, and as a band 7 I was a nurse prescriber and was able to prescribe the medication. On a Wednesday, I worked at another outreach hospital. I worked at Stafford, and I would see DMT patients for new assessment. So that is screening patients who've got a diagnosis of MS and are eligible for disease-modifying therapy. And we would go through the various drugs, discuss with the consultant neurologist, and make a decision usually on that day. And then that would be followed up by disease-modifying therapy follow-up patients who would be on the various treatments, of which is great. There are so many now, so you could see patients on any of the drugs and they would be monitored to make sure that the drug was working for them, to look at their side effects and to help manage and support the patient in that way. On a Thursday, we were fortunate enough to have an on-call service, so each of the band 7s would be on call for one day of the week. My day was a Thursday, and on that day I might see some patients either in clinic if they were in relapse as an urgent patient, or I would do telephone consultations throughout the day, and again speaking to the consultant neurologist where necessary. And Fridays, because I was part-time, I had a day off on Friday. So the job is really, really varied, and again in different centres will be different. At the Royal Stoke, generally we were seeing about 30 patients a week for full-time nurses. So it's quite a lot of patients, plus the telephone consultations. And in between all of that, it's about keeping yourself educated, attending study days, going to conference if you're fortunate enough to, and developing protocols. And our managers are now very keen on standard operating procedures, SOPs, so we will be developing those as well. So it's not just sitting down all the time, and a lot of it is between different hospitals and working again with the community, with the wider multidisciplinary team. So yeah, quite varied.
Very busy.
Yes, which I liked.